So I'm a plastic surgeon in Houston, and we specialize in getting the optimal natural results for what patients want, right? And some of this stuff comes down to the details that we pay attention to. As a plastic surgeon, we pay attention to the details of reflection and the shadows, hiding the scars in an imperceptible fashion, and also giving natural results so you don't look overdone. The areas that I specialize in terms of the face and neck, essentially are the main components of what we do. We also do some body procedures as well at Lift Plastic Surgery. So one of the biggest things that you've been hearing about is medical weight loss. And right now, the medications have been changing drastically in what's available to patients that want to lose weight. We have this program called Slim Fit. It's not just slim, it's Slim Fit, right? And the reason is because when you just use these medications as GLP-1 analogs, which you've heard as semaglutide, Ozempic, Wegovy, Mounjaro, Zepbound, all these different types of medications, but they all do the same thing in terms of the mechanism of action. It's on your pancreas. That causes you to lose 40% of your lean muscle. So what we've done is pair it with some forms of peptides to help you increase that lean muscle mass while you're losing the weight. And that's why we call it Slim Fit. So I'm board certified in plastic surgery and general surgery, and I also did a fellowship in craniofacial surgery at UT Southwestern. So we do our procedures at Lift Plastic Surgery in Webster, Texas, and we have our own operating room that we have board-certified anesthesiologists that specifically focus on safety and security in terms of your overall health. When we know that you're safe enough to undergo these procedures, that's when we can do them in our facility and do them in a safe place to give you the optimal results. So complication rate for procedures, it really depends on what procedures we're doing and what complications we're talking about, right? The main ones that we try to avoid are bleeding, infection, and scarring, right? And those are the things that usually come with any type of incision that we make. And complication rates are super low, especially in our own facility, because we know the people and the equipment is sterile in terms of what we need to do the right job for you as a patient. So we have done thousands of procedures, and we're able to show you some before and afters, depending on if they have written a release of records or a release to share photos with you. We can share our work with you in terms of in the office, and some of our work is also shown on our website. So our consultation process starts with our intake, taking down your information, your medical history, seeing if you're a good candidate for actually what you want, and then identifying the right procedure for you in that area to get you the result that you want. We ask you to bring in photographs of you as a younger age, and then also other photographs of other people that have the same body frame as you, so that we can match up the result to get you exactly what you need. After the consultation, usually there's a preoperative visit that comes 2 weeks before the operation. That 2 weeks before is to get you prepped in terms of any garments, any preoperative medications that we want to get you set up with, and the things that you shouldn't take in terms of your current regimen. After surgery itself, the day of surgery, you're going to come in, we're going to do the assessment with an anesthesiologist, actually go through the process of the procedure. We ask you what your wants are to make sure that we hit them adequately on the day of surgery. Once that is done, we have a post-op follow-up routine. Usually this is at 1, 3, 6 weeks after surgery, and then we do a 6-month and 1-year follow-up to make sure that our results stand the test of time. So for safety, our facility is certified Quad ASF, and it actually provides all the different things and follows the handbooks and all the procedural guidelines to make sure that you have a safe experience with the best results. So the anesthesia that'll be used depends on what procedure you're actually having done. There are things that we can do awake, and there are things that require you to be asleep. So once we identify the right procedure for you, we have a board certified anesthesiologist that is present to do the anesthesia itself, whether it's awake where we don't need the anesthesiologist, or if it's asleep and either we're doing general or TIVA or something like that, then they're able to provide that in terms of your procedure, but it just depends on what we are doing to get you the right type of anesthesia for the right results that you want. So recovery after surgery depends on the type of procedure that you have and what this is the downtime. And then that can range in terms of whether it's for a facelift, if it's 2 weeks or so, or a tummy tuck that can be 4 to 6 weeks. And it really depends on the actual muscle tightening that we're doing and all the different invasive components that may limit your activity in terms of what recovery is needed. All wounds usually heal at 6 weeks, so there's no heavy lifting or no big workouts, no swimming usually for 6 weeks.